Okay, so let's demonstrate how to loosen a scar fast.
Tighter scar, a lot of time you want to
Loosen it fast.
30-40% at one time. It's not like a detail like this. A lot of time we can do a little bit more.
Okay.
More rough.
Rough, fast, quick, and dirty way, like Dr. Khan would say. So we'll work on this vertical scar here.
Okay, bend your leg. So one thing is when we want to cut the paper, use a scissor to cut the paper.
No, I just rip it up. Just kidding. Okay, so use a scissor.
We want to use a scissor to cut the paper. If that's loose, it's very hard to cut, right?
Yeah, you have to.
But if you tie it up,
it.
a lot of time your scissor just touch that, it split by itself.
Okay.
Okay?
Same
For
concept.
scars, same concept. A lot of time we need to tighten a different layer of a tissue.
That makes sense.
Yeah. So for example, we make a body twist, it's kind of extend that, right? So two legs go one way.
So why don't you have her leg go straight? That's tight.
Because in this way we can make the body going like this.
Oh, okay.
So we want make an upper body and lower body become like a twist.
How about the hand?
Hand just relax, you can put it here.
Okay.
Okay? You can let the leg go one side and the head go the other side. So temporarily increase the tension.
Okay.
In this way to find whatever is tied up. And
Okay,
usually,
so first step is to increase the tension, the legs to one side, the head to the other side. Next is feel the scar.
yeah, that's about just strategy is tied up different layer. It's by your own creation. You can do a lot of different things. But that's I just demonstrated the thing I usually use.
Okay, show us how you do it to quickly release.
Quickly,
the
a lot
scar.
of time if you don't want to do that detail, but if you when you tighten that, you feel more easier to feel the tighten spot. Still try to find a tail of a tighten spot. You can just tape in whatever you want. Because you tighten
straight
that
right on the scar or on the side of the scar.
side, or I feel that's in higher tension.
Oh, okay.
Okay, and I just slightly pull back close to skin.
So you never needle onto the scar. It's always on the side.
If the tension right on the scar,
you will needle into
I
the
needle
scar.
into the scar.
Okay.
But usually you want to dissolve from the border,
From the border.
like a mess. If you like a mess, you want to keep poking into that, it doesn't make that loose. But you peel from the outside
side?
border,
Okay.
slowly dissolve, like a tangle line. I cannot talk about in my
class?
PowerPoint. Yeah, in class, a tangle line. You want to lose that one by one from the outside.
From the outside. Peel
If you
away.
just poking that, you just lock that.
Okay.
Yeah.
We don't
Okay.
want to lock that.
Yeah. So we increase the tension and go to the whatever most border you can feel, and just still give a stimulation. You can go faster, or go in and out until the thing you feel looser.
So if they tell you they feel a sharp pain, what do you do?
I just stop and pull out and go slowly.
Okay.
Usually I will tell them if there's a soreness, that's okay. Electrical is okay. Sharp line and local in the distal is okay. And split feeling is okay.
Split feeling? What
Sometimes
is a split feeling?
sometimes a big scar when you suddenly lose, you feel like a split, like a rip.
Oh, they'll feel like the scar is ripping?
Yeah, some big
And
scars.
that's okay?
That's okay.
Oh,
Okay. But if sharp,
no good.
and usually if you let them tell you you're not going further, you can prevent bruises or
What
bleeding.
kinds of pain I'm going to have?
Your scar, this one actually is not too bad, so you might not feel too much. We just demonstrate, okay? So same thing,
会痛
increase
吗？会痛要讲
没
哦。
感觉啊。
increase the
没感觉。
tension, just go in and out until you feel, oh, here's one move. And you can go faster, it's not a detail. Oh, okay, the other one move.
So sharp feeling is usually you're poking a artery.
Even though if I go forward, looks like this fast, I still try not to
Go too fast.
penetrate. If I feel the
Penetrate.
resistance, I still stop in there.
Okay. Don't push if you feel the resistance. You want to let the fascia loosen itself again.
Okay.
That's the key.
So, like this method is we keep changing direction, like keep changing whatever tension line is. Okay? So we can change to the other way.
Oh, while the needle is in, you change the other way.
Doesn't matter, you can pull out. It doesn't
Okay.
matter. The head going that way.
Head to the right.
Yeah, we still increase it.
然后这个脚就往这边，
Okay.
要把你的肚子张越大越好，这样。
And the other key is if you want the thing twist, increase the tension, you want the, okay, go back. you want the two legs open a little bit.
Okay.
Okay.
Oh, so there will be more tension.
So if you fully close, when you roll, you can try that at home. Actually, the whole pelvic move. You feel the spine move. The
Yes.
core tension is not moving much.
Oh, that's
Okay?
right.
But if you want the inside core tension change,
Open the
or
legs.
the body, like a big cylinder doing rotation, not like this rotation, like this rotation. Then you have to make it open so the core can be one in, one out.
That makes sense.
Yeah. Okay. And just
The
same thing.
core rotation.
Pull to the as shallow as you can, or just reinsert that again. And same
Oh,
thing.
same point.
Same point. Because you feel a tight one.
Oh, it's hard to
Oh,
see.
see, like right now my needle tip poking out something tight.
Then you stop.
If the earlier angle I feel is not changing that much, so I pull to like in twist and pull to the surface and reinsert again and try to see if I can give a stimulation. Like a cutting paper, the paper is wrinkled. You try to smooth out the wrinkle in different direction and give a stimulation.
So the idea, he said, is like flattening the paper, with the body rotation, and then still stimulate with the needle.
Yeah,
to try
and
to
a lot
break
of
it
time you feel the needle tip something still cannot loose, and you can try to use the other thing to tie up the other layer. For the common abdominal area, especially the cough is a good way too. Okay, sometimes we need cough too. Nah, okay. A lot of time in the like C-section scar or something not related to the uterus tension. How would you tie up uterus?
I don't know.
You can use vagina as the other end. So a lot of time we doesn't contract the vagina and the anus, contract the pelvic floor muscle. 就缩阴缩肛夹紧. Then internal layer become tied up, and surface layer has a different tension with that. Same thing like a
deeper level.
yeah,
is
tied out the
tighter.
paper. We do shallow rotate. We can also do the deep and shallow tension change. Okay.
So all of this is basically trying to realign all the fascia.
We create tension. Like I said, that's a mess. Is a lot of different wrinkle. We try to smooth out the paper in
Different
way
directions. Yeah,
and give a stimulation to make it
see.
split.
Okay.
Okay. So tied out the vagina is contract the pelvic floor is one way, and give a stimulation, and wait until the needle tip loose. That's a demonstration. I'm not really feel something. We just demonstrate. And reverse was let her relax. Reverse was push the pelvic floor down, like give birth and poo-poo. And same thing, it gives a stimulation. Because you do that way, the inner layer is moving different direction.
So do you do one point and you do all that and then start over again a second point and reverse the leg back?
Yeah, you've just want whatever is the adhesion part.
Oh,
and
okay.
just try different way to lose that point.
So in a previous session, I learned with the teacher, they would needle all around the scar on the side. They don't feel the tension area like you do. But for your method, you feel wherever there's tension, then you stick the needle. If there's no tension, you don't need to stick the needle.
You drop the gun on the floor, wait for a shot, or you're looking for the trigger.
All right, we don't want to waste needles. Let's look for exactly where it is, and
But
go
there's
at
a
it.
condition, like just after the surgery, like 2 weeks, 3 weeks, that time, you cannot do too much
Rotation,
movement
because it's not
you
healed
want
yet,
it healed.
right? Yeah,
But
okay.
to reduce the scar tissue growth, you can do a lot of tiny needle right on the scar, right next to the scar. It can help.
Or reduce the scar from forming badly.
From the scars forming bad.
Okay.
So that's one thing can do. A lot of time my patient have a C-section. I'll
You tell them to come back in 2 weeks.
In 2-3 weeks, come back. We do
It-
gentle needle first. In 45 days after, usually it's grow well. And that time we can do like a rotation, increase the tension to split.
So the initial treatment is so that the scars don't adhere too much, right? And get all glued in the wrong way.
Reduce the
Adhesion.
adhesion.
Okay.
But they still gonna grow adhesion.
Right, but
we
not
try to
so
reduce,
bad.
not so bad.
So the patient says that because of the scar, her abdomen usually will feel cold.
Yeah.
So we'll try to do this method and see if that'll improve the circulation, which I think it will, because the chi and blood will flow much better,
but
right?
Just how detailed we do.
So in her case, it's been 30 years. How many
Yeah.
treatments would you say she'll need to come in for?
I don't know. I never guarantee. But from what I feel here,
Yeah, estimate,
I think to feel better, maybe 3, 4.
3 or 4 times only? Oh,
Because
this is promising.
Can start to feel better.
Yeah, okay.
Because her bigger thing is not
Not the middle one.
Not the middle one.
Yeah.
Not very tight.
It's the side one.
And muscle can slide through. So means this lock actually is not that bad. And earlier we checked the lower back. We have some resistance, but actually she can have some movement.
Good.
So it's not locking there.
Okay, wonderful. What a great method to learn.
Yeah.